with Dr. Vanita Zahn.
So much has been going on in the COVID vaccine front. The Johnson & Johnson vaccine has been started to be administered. Merck Pharmaceuticals agreed to help manufacture that vaccine to boost production. So this is all increasing the numbers of people who have gotten both shots of Pfizer or Moderna. Goodness, so what's the difference between these three vaccines? What do the numbers mean when it comes to efficacy? That's a biggie. To help sort it out, I've invited Dr. Eric Yager back. He's the Associate Professor of Microbiology at the Albany College of Pharmacy and Health Sciences. Always good to see you, Dr. Yager.
Good morning, Vanita. Nice to see you again.
So let's just start with that efficacy that's got people going, whoa, I want the one that works better. Then you've got, you have the CDC, as you know, Dr. Fauci saying, just take any vaccine.
Right.
Help us understand.
Sure. So the vaccine efficacy number is, people need to understand, it's a number associated with the clinical trial. And if we compare these three vaccines, they were tested at different periods of time. So it's difficult really to compare these numbers side by side. That said, I can appreciate people look at the numbers and your first glance would be, well, one vaccine is clearly better than the other. I don't want that new vaccine. It seems kind of bad or third rate. But the important thing to keep in mind is that all three vaccines, as Dr. Fauci mentioned, are very effective at preventing severe disease, hospitalization, and fatal outcomes due to COVID-19. Additionally, I think the numbers that I keep in context here is that think about our flu vaccine. We get a flu vaccine yearly. Many of us get it. It's important that flu vaccine is very effective at preventing hospitalizations, hundreds of thousands of hospitalizations a year, thousands of deaths per year. And the efficacy of that vaccine ranges from 40 to 60%. So we have three vaccines here for COVID-19 that are, if you use that number, better than our flu vaccine. So I think people should be reassured that all three currently available COVID-19 vaccines were tested the same way. They're safe, they're effective, and they're going to really help us lower the number of cases, hospitalizations, and deaths due to COVID-19.
Now, we know that the Pfizer and the Moderna, the so-called mRNA vaccines, were created without any use of a live vaccine at any point. It's not a killed vaccine. It's not a knocked down to the ground virus, rather. But the Johnson & Johnson, now help us understand the creation there, because it's a little more traditional, isn't it?
It's so the Johnson & Johnson vaccine utilizes adenoviruses, which are cold viruses that cause minor illnesses in people. And why scientists selected these is because they've been very useful in delivering products to human cells. They've been studied for decades to deliver therapies such as gene therapy in the past. And really why to think about these vaccines and how they're similar, the goal of all three of these vaccines is to deliver the blueprint for the viral spike protein to our cells, so our cells can make it and educate our immune system to protect us against the actual infection. So the adenovirus approach simply just delivers that message, that blueprint, in a different way. So the Moderna and Pfizer vaccines use messenger RNA. The adenovirus vaccine, the Johnson & Johnson vaccine, uses DNA. So the virus is alive. It can't replicate in our bodies. It simply is used as a delivery system to give that DNA blueprint to our cells so that we can develop a response against the virus.
There are some folks who got their first shot. Maybe they got a Pfizer and for whatever reason were unable to get the second shot, Pfizer. But now they can find Moderna for a second shot. Or, wow, I could go get a J&J shot. Can we mix and match?
So the current recommendations are not to mix and match these vaccines. So if your first shot was Pfizer, you should stick with Pfizer if possible. There were some kind of extreme cases where if the vaccines were not available or there was a long period of time before you could get your shots, you could potentially substitute Moderna for your second Pfizer shot. But by and large, the CDC and recommendations and the studies used to show the efficacy of the vaccines were using the same vaccine for two doses, the Moderna and Pfizer. And for the Johnson & Johnson, it was just the Johnson & Johnson shot. So these aren't interchangeable vaccines. Again, it is kind of, it's a good and bad thing. The good thing is to have a broader arsenal of vaccines against this virus to increase our landscape. To think that a year ago, we were kind of in the beginning of this pandemic, that we now have three effective vaccines is amazing. But it can be also somewhat confusing to determine like what vaccine's out there, which one should I get, what's my next shot. But really the recommendation is if you get the Pfizer and Moderna, first shot, second shot's going to be the same. If you get Johnson & Johnson, your only shot currently is that Johnson & Johnson vaccine.
And then the other question, and really I've got so many, so you're going to have to come back, but the other question we hear a lot is, once I have both of my shots, I'm getting them, my spouse can't get a shot for age reasons. Am I safe? Are we safe together? Can I possibly infect them?
Right. So that's the data. That's kind of the next step that's being looked at with these vaccines is can they prevent transmission? And these vaccines in those clinical trials really showed efficacy in preventing disease. And vaccines can do two things. They can prevent disease or prevent infection. We don't yet have a good understanding of the ability of these vaccines, any of the three really, to prevent transmission. So the recommendations really are to continue with the same safety precautions, mask wearing, social distancing, limit large crowds, until we have a better sense of can these vaccines really prevent transmission. And that data it's being looked at. It's forthcoming. So I think definitely having the vaccine is you can breathe a little bit better. You are protected. Can you start having family get-togethers and parties? I don't think we're quite there yet until we have more people vaccinated and herd immunity becomes closer to reality.
Yeah. And I should point out, we work a little ahead of time. So you and I are talking on March 3rd. This will post on March 18th. And you and I joked before we started, the official part of the interview, that sometimes things change within the hour. So
True.
Everything we're discussing is fact for the 3rd of March. So
exactly.
If it's a little, right? But it's always great talking with you, Dr. Yager, so I reserve the right to get you back.
I look forward to it.
All right.
Best wishes and stay safe, Benita.
You too. And thank you all so much for your time. And remember, Newschannel 13 is your vaccination station. If you've got questions, we're going to get you answers. Just email us or hit us up on our webpage. Till next time.